let's take our seats. We want to begin this function. We are running about 10 minutes late, and we really want to keep time, especially given that a big proportion of stakeholders in malaria are following this live across the African continent, so we don't want to delay them at all. I will request some of the council members, these two tables are set for you. Let's keep the COVID protocols. So some of you can come and sit. Eva Mudhuri is very lonely on this side. Please come and keep him company. If one of the members can come on this side, that's good. So, can somebody who is doing the prayer? Joy. So let me call Joy to give a word of prayer, and then I'll introduce myself and we start the proceedings.
Okay, good morning, everyone. Let us be in silence and pray. We thank you, Heavenly Father, for this morning that you've given unto us. Thank you for having assembled us here to mark yet another step in realization of our free malaria status that we envision for this country. We commit this day unto your able hands and ask you, the dear Lord, that you may guide us, the deliberations that we shall have, and the ceremony, Lord, may it be a success for the glory and honor of your holy name. Thank you for the chief guests and those that have been able to come, even the council members. May you continue to guide us and take care of us. This is our prayer of faith in Jesus' name. Amen.
Our chief guest, the Cabinet Secretary for Health, Honorable Mutai Kagwe, the Chief Administrative Secretary, Madam Masi Mwangangi, distinguished ladies and gentlemen, it is my pleasure that I will be the master of ceremony for this very, very great event that marks a very key milestone in the war against malaria in this country. I am so excited at a personal level with 20 years experience in malaria that we are taking a corner that will put us really on a path that we can write about our war against malaria. I'm a senior advisor with the African Leaders Malaria Alliance. I've been in this position for 7 months. And when I took over this position with the task of supporting His Excellency President Uhuru Kenyatta to ensure that we eliminate malaria not only in Kenya but the African continent, I went through his legacy agenda and I saw one very key thing in it. He is advocating for the formation of end malaria councils so that we can have local resources to fight malaria on the African continent. Within his legacy agenda, he's also saying we need to work with communities. We need to mobilize communities, and that the youth should be on the forefront. A few weeks after I took my job, I met our chief guest, the Cabinet Secretary, and he asked one question. Other countries have eliminated malaria. What are we not doing right? I did not want to give any scientific answer, but with that, I knew I had been given marching orders to start my work. And that work meant that we must do something to form a council for Kenya. And at the same time, I reflected on a few publications about malaria. There have been many countries that have eliminated malaria, like Cuba, Italy, and Japan in the recent times. But closer home in Africa, there have also been countries that have eliminated malaria, like Zanzibar, and off the coast of West Africa, Cape Verde. And there are lessons that we learn from these ones, especially in Africa. And the lesson which have been published is that both Cape Verde and Zanzibar has eliminated malaria 4 times, and malaria has re-emerged 5 times. And somebody looked at why this was occurring and realized it is correlated to the availability of resources as one, and the community engagement. Once the amount of money goes down, your malaria is likely to come back. So you must sustain those efforts, and you must fully involve the communities. Similar findings have been found in a country called Vanuatu, Pacific, which also has a challenge with malaria. So that was one very key lesson. And therefore, for me today, the fact that we are here assembled to launch this is really, really a great day and a great milestone. So I'll be your master of ceremony, and I'm going to call Dr. Nazila Ganatra. Oh, she's here. Please, just stand there. I'll say something before you take over, because from here I'm an advisor, but at the end of this, I'll become a secretary to the council, so I'll be getting a promotion. Now, Nazila Ganatra, I met her about 6 months ago. I'm 7 months now in my job, and we were supporting the National Malaria Program, planning for the planned larviciding of malaria breeding sites in Western Kenya. And Nazila, when we were planning, I talked about some lazy mosquitoes. And Nazila told me, I've never heard about lazy mosquitoes. Tell me something about them. And I told her, do you know we have 400 different types of mosquitoes, but only 80 cause malaria. We have those that breed in the rubbish and the broken sewers. We call them culex. These are the ones you find in Nairobi. They don't transmit malaria. We have others called Aedes. They breed in stones, construction sites. You are part of the stone where they breed. So they are very painful in Nairobi. You keep scratching yourself. Then I told him, there are those that transmit malaria, and they are called anopheles. I told her rather. Those ones which breed in fresh water, like in Western, around Lake Victoria, they are very efficient. They know where to sleep. They know when to target you in the middle of the night. They will even anesthetize where they are biting. You will not feel the pain until they have fed your blood. And then I also told her there are others, they transmit, but they are a bit lazy. They don't even know when to get into the house. These ones are called Anopheles merus, and in the coast, they breed in salt water. So if you look at how many bites you get per night per person, the one in Western and Nyanza are very high, and these ones are very low. So I'm just saying this to introduce the fact that we have work to do, because the vector and the parasite that cause malaria have evolved and continue giving us challenges. So ladies and gentlemen, I'll be your master of ceremony today, but I now want to hand over to the head of the Department of Strategic Public Health Programs to take you through this day, and you are most welcome. Thank you.
Thank you very much, Dr. Akwale, for that introduction. Our chief guest, CS Honorable Senator Mutahi Kagwe, our CAS, Dr. Mercy Mwangangi, Senior Advisor ALMA, Dr. Willis Akwale, members of the End Malaria Council, development partners, the WHO, Dr. Rudy Eggers, USAID PMI, who are joining us virtually today, ALMA Secretariat, that is the African Leaders Malaria Alliance, KENAM, Kenya National Malaria Alliance, Dr. Edward Mwangi, representatives from the media, the Division of National Malaria Program, all colleagues from the Ministry of Health, all protocols observed. Ladies and gentlemen, good morning. So today I'm just going to give a brief introduction about the objectives of our meeting here today. So I'll just begin. Malaria is the second leading cause of morbidity in Kenya after diseases of the respiratory system. It accounts for about 15% of all hospital outpatient visits, and it is the seventh leading cause of death. The African Union and Kenya have set an ambitious target of eliminating malaria by 2030. His Excellency, President Uhuru Kenyatta, who is the chairman of the Africa Leaders Malaria Alliance, ALMA, has called for an establishment of a country-led End Malaria Council to convene influential leaders to champion malaria control and elimination. On the 15th of January this year, the Cabinet Secretary, Senator Mutahi Kagwe, appointed Kenya's End Malaria Council and fund members. Today, we gather here with three main objectives: to unveil the End Malaria Council and Fund members, to inaugurate the End Malaria Council members, and to witness the appointed End Malaria Council members accept the charge. Indeed, it is a great day for Kenya in the fight against malaria and a huge milestone towards malaria elimination. Thank you. I call upon Dr. Githuka from the National Malaria Program to take us to the next agenda. Thank you and welcome.
All protocols observed. Good morning. As you've been told, my name is Dr. Githuka George, the head of the program, and I'll briefly take us through the overview of the malaria program in the country and the gaps and the challenges that we have, that we are hoping that with the inauguration of the End Malaria Council and Fund, we'll be able to work together and achieve our goal of eliminating malaria in the country by the year 2030. So I'll just give a brief update on the progress that we've made in this country since the year 2000. We have had a reduction, a sustained reduction in the malaria incidence by 74%, and this has been achieved through a lot of evidence-based interventions that have been scaled up over time and avoided 102 million cases of malaria in this country since the year 2002. And just to show how that has changed, the epidemiologic map of the country, this is how the map looked in the year 2002, where we had areas like around Lake Victoria and around the Indian Ocean, especially in Mombasa and Kwale, where we had a prevalence rate of malaria of above 50%, with most other areas in the country being between 20 and 50, with only the central parts being less than 5 and sometimes less than 1. And this is how the map looked in the year 2016. We had drop in the malaria cases around the coastal region by going all the way to less than 10%, where it's currently at 8%. And in the Nyanza region, we almost halved those the prevalence to where it was in the year 2016 at around 27%. In areas around where we are seeing a bit of light orange and dark orange are what we call the seasonal transmission areas, where we've continued to have sustained reduction in cases. I think you'll bear witness that in the early 2000s, we used to get a lot of malaria outbreaks being reported, even in the media. And you know, hospitals being full of cases of malaria. But we hardly get that now with just isolated cases. You know, for example, we have emerging cases like in sub-counties, like Loima sub-county in Turkana, or Tiati sub-county in Baringo. The mortality rate has also declined significantly since the year 2000. I think, as has been put by Dr. Nazila, malaria is the second cause of illness in this country, but it is the 7th cause of mortality. And we would wish that to drop to as much as zero mortality, because it is treatable. We have medication that the parasite is sensitive to, that are easy to take, a dose that is, a whole course is less than even 5 days, and actually have very little side effects. So this is another place that we need to really add our effort. And as I was saying earlier, the country is divided into 5 epidemiologic zones. With the lake endemic area, the counties around the Lake Victoria being the highest, having the highest prevalence of around 27%. I think, as Dr. Akwale has said, the mosquitoes there, if you don't put a barrier between them and humans, then they are very aggressive in terms of the number of bites and the transmission for the parasite. Then we have the coast endemic area, where the prevalence is around 8%. That is followed by the highland epidemic-prone regions, the ones in light blue. That is where you get, maybe when the rainy season is there, then the cases go high. And then you have the low risk, the arid and semi-arid regions also do get seasonal transmission, but the areas around the center of the country, central and lower Rift Valley, eastern, what we call low risk areas, where the prevalence is less than 1%. And I think even if you are bitten by a mosquito in Nairobi, as Dr. Akwale has said, it's most likely not a malaria parasite transmitting mosquito. And most of the cases that we see in here are usually imported. But to put it in a nutshell, 70% of this country, of the population in Kenya is at risk for malaria. If we say we are around 50 million or so, translating to 36 million people. And these are the people we need to target when we are putting all the interventions for malaria. What are the key to our success? To up to where we've gotten to, and to go to where we need to get to, of eliminating malaria by the year 2030. We have the political will on the fight against malaria, and I believe that is what is being demonstrated here today. I think by our president being the chair of the Africa Leaders Malaria Alliance is witness. You can see the pledge that the president signed late last year on October 31st in Mombasa, where he pledged, where he committed to be a champion to fight against malaria. We have governors also who signed on to that pledge. Even our CS also did sign to the pledge. We have to focus on high burden areas that we have seen. The Nyanza, the lake endemic region, that's Nyanza Western region, and the coasts. And we need to, the interventions that we put there, they need to be high impact and they need to be sustained. Again, as has been said, if we make progress and we relax, then we see a reversal in the gains that we've made. And the only way we can be able to sustain those high impact interventions is, again, ensuring that we have adequate resources and sustaining them and increasing them. So as the malaria response in the country, we are normally guided by one document, the Kenya Malaria Strategy, that we started implementing between the year 2018-19 to 2022-23. We are in the middle of implementing that strategy, and we are about to do a midterm review. And this is timely because also late last year, we did do our malaria indicator survey. As we saw the data that I projected there, it was 2016 data as per our last malaria indicator survey. So we did one last year, and we hope that by World Malaria Day, which is on 24th April this year, we'll have some preliminary results that can be able to tell us, are we on track towards sustaining the gains that we've made since the year 2000, or are we stagnated or reversing? So this is the vision, mission, and goal of our Kenya Malaria Strategy. We want to reduce the malaria incidence and deaths by at least 75% of the 2016 levels by 2023. And as I said, we are in the middle of implementing that strategy, and we'll be able to see whether we are on track by the data we get from our malaria indicator survey that we did conduct. But of course, our vision is to have a malaria-free Kenya, and to direct and coordinate efforts towards malaria-free Kenya through effective partnerships, which is what we are witnessing here today. These are the strategic goals that we have within our malaria strategy. We want 100% of the people who are living in malaria risk areas to have access to malaria preventive interventions. In Kenya, we have 2, maybe 3 effective interventions that we implement at a public health scale. Number one, and most effective, is usually the long-lasting insecticide-treated nets. In this country, we have a dual strategy of implementing this. We do normally, in the malaria risk areas, we do normally give mothers who are pregnant and mothers who come with children who are less than 1 year old. We give them a mosquito net. The reason we do this is that pregnant mothers are the most vulnerable to infection with malaria. We know malaria amongst pregnancies is a leading cause of abortions, of low birth weight, of stillbirths, or even maternal mortality, because it causes anemia. And when a mother is delivering, they do bleed. And if they already have low blood levels because of the parasite, then it also leads to maternal mortality. And amongst children also, the ones who get infected with malaria, they are more likely to get into severe illness. It's likely to complicate their development, again leading to malnutrition, to stunted growth, and also higher mortality amongst the children. That is why we give those nets to the pregnant mothers and children less than 1 year. But also the second strategy that we implement is a mass net distribution that we do every 3 years, where we target to cover the 70% of the population who live, the 70% of the Kenyan population who live in malaria risk areas. This year we are targeting to distribute 15.7 million mosquito nets. It's a process that we have already started by planning with all the counties. This is in 27 counties. We have already planned with all the counties, and the next step is to go ahead and distribute the nets. These nets are distributed. We target to capture around 27 million people to sleep under a net after this campaign, leaving a gap of around 8 million. If we said 35, 36 million people are at risk. And that is one of the gaps that we have. The reason we do it every 3 years, that is the lifespan of a mosquito net, in terms of the insecticide in them being effective, and it being able to maintain its integrity. The number 2 strategy that we have, or rather the number 2 way of preventing, we do indoor residual spraying in a few selected counties in the lake endemic region. And as Dr. Akwale mentioned, we are planning to also start, or we've been in the process of starting, the larva source management, the spraying of the mosquito breeding sites in the lake endemic counties in collaboration with Cuba, what we are calling the Kenya-Cuba Vector Control Project. The number 2 strategy is to test and treat 100% of all the people who we suspect as having malaria. In this country, for us to give you treatment for malaria, we must diagnose you either through microscopy or rapid detection kits, and we have effective treatments for malaria that the parasite is sensitive to. And so it's effective, and as I said, very low side effects and a short duration of taking of these drugs, and also easy dosing. Number 3 is utilization of appropriate malaria interventions. This, you see, the 1 and 2 are 100%. The third one is quite a challenge, and that's why maybe we have targeted at that, but we wish to reach 100%. We know it's one thing to have the mosquito nets distributed. A lot of people will still not sleep under a mosquito net. People will find other uses for them, as has been documented before. And therefore, we need, on top of giving the mosquito nets, on top of making all diagnostic and treatment products available, we need to educate our public, we need to sensitize them to be able to take up these services to reduce the severe, to control and treat malaria. And I think this is one of the places where Dr. Akwale again has said the engagement of the community is quite critical for them to own these interventions and take them up. So to be able to achieve those 3, we need to establish systems for malaria elimination in targeted counties in this country. We are planning to start from the center, moving outwards towards elimination. And I think we have targeted 4 counties in setting up structures for elimination, like Laikipia County, Nyeri County, Kirinyaga County, are the counties that we plan to start with. We also need to strengthen malaria surveillance and use of information to improve decision making. Again, because of climate change, because of the way the climate is changing, we are having areas that previously never used to be malaria endemic areas becoming endemic, and so we need to monitor, even where there is seasonal transmission, to detect upsurge in cases early and respond to them early enough. And again, is to have leadership, to coordinate leadership and management for optimal implementation of malaria interventions. So these are the malaria funding sources. Number 1 is government. We have seen as a proportion of all the funds that are required for malaria response in the country, there has been a sustained increase in allocation from the government, both national and county, from 29% in the year 2009-2010 to 46% 2016-17. We are analyzing our national health accounts, and we should be able to have our data for the year 2019-2018. This is the contribution of donors. Last 2016-17 was around 18%, but we know with Kenya being a low middle income country, and also other competing public health conditions like COVID in the world, we foresee this donor support going down, and so we need to scale up further. The rest is household, quite significant, although it has reduced over time from 47% to 25%. But these households that spend money on management of malaria, normally they will do it within the private sector, and most likely leads also to catastrophic costs. So it's one area that we need to target to reduce, but also improve the quality of care within the private sector. And then the 10% is private employers through even the private health insurance schemes that are available there. And finally, this is the resource gap as per the malaria response in the country and as documented in the Kenya Malaria Strategy. And we've divided them into the key intervention areas. Overall, within the 4 years of implementing this strategy, from the year 2019 to 2023, we have a resource gap of 24 billion Kenya shillings. If we were to divide it evenly, which is not scientific, it would mean a resource gap of 6 billion shillings per year. The areas where there are gaps, as you can see, in malaria prevention, where we talked about mosquito nets, indoor residual spraying, etc., we only have been able to meet 61% of the need. In case management, where we talk about diagnostics and treatment, 81%. Here is where we talk about testing and treating for malaria, both uncomplicated and severe. Malaria elimination is a new agenda that we are already beginning to set up structure for. And so we've not been able to have any funding there. And the figures below there are the billions in terms of gaps. So even when we are talking about malaria prevention being 61% funded, the gap in terms of finances is big. There is a surveillance, it's 33%, around 3 billion. There is social behavior change, where we said people need to uptake these services once we provide them. And program management, where we are doing well, because this is what the government has provided in terms of even human resource and in terms of the management and coordination. I think as I finish, I'd like to say the reason why there is a big gap in malaria prevention, also mosquito nets are not cheap in terms of having them and distributing them and using them, but they are still the most effective prevention intervention that we are implementing currently. So this is where our challenges are moving forward, and we hope that with the inauguration of the End Malaria Council and Fund, this will be the areas of focus. Thank you very much.
Thank you very much, Dr. Githuka. Thank you for taking us through that. You've seen the gap, and you now know why we are here. Serious business to fight malaria. We have the will, and we have the human resource. I wish to now change gears so that we move to the next agenda item. And this will be facilitated not by the Principal Secretary, who could not join us here this morning. She is busy elsewhere, but we have our Chief Administrative Secretary, Madam Mercy Mwangangi, with us. I will now call her so that she can unveil the members of the council so that we know who they are and what they will be doing within the council. Welcome, Madam. Let's clap for her as she comes.
Thank you. I think it's a bit high, but there we go. That's great. Perfect. Thank you, Dr. Akwale, and thank you to all of you for making time to be here today. Indeed, it's my distinct pleasure and honor to introduce members of the End Malaria Council, members who will be given the task of saving 36 million lives in Kenya. And so it's a huge, monumental task, but one that you're all able to deliver. And I can see someone raising their eyebrows and thinking, 36 million, yes, 36 million all on you to really help and work with us in terms of creating advocacy for malaria, creating awareness when it comes to how we can prevent malaria, when it comes to creating platforms for accountability, when it comes to creating platforms for resource mobilization. With a gap as severe as highlighted today, we really do need you all to come together and support us in this. So I'll jump straight into it. I will read out the bios of the members, and I'll request as I read them out that that member can stand and wave to the crowd and take a bow. And I'll start with the chairman, Mr. Christopher Gitonga. He is an entrepreneur who over the last 20 years has been at the forefront for creating world-class pharmaceutical and medical facilities in Kenya. He is the founder of the pharmaceutical retail chain Good Life. He's also invested in areas of frozen food and catering businesses in Kenya, and he serves on several boards of management in Kenya and has been previously nominated as a councillor in Nairobi City. Kindly, Mr. Gitonga, I'll request you again to stand and wave and take a bow. Thank you. Secondly, we have Mrs. Dorothy Nyong'o, who is not here with us today. She's given her apologies, but she stands firm with us in this new task that we've given her. She is the First Lady of Kisumu County and is the Managing Trustee and Co-Founder of the Africa Cancer Foundation, a winner of the 2019 Harvard Global Health Catalyst Cancer Advocacy Champion, and has over 30 years experience in PR and in reproductive health. And we applaud Madam Dorothy Nyong'o wherever she is. Thirdly, we have Mr. Patrick Karako. He's also unwell, so he's not with us today, but he's joining us online. He is the chairman and CEO of the Radio Africa Group. He has extensive experience working in the media. His expertise and experience will be critical to ensuring that malaria remains visible and that critical and impactful malaria messaging reaches the eyes and ears of every Kenyan. Again, a round of applause for Mr. Patrick. Thank you. We have Dr. Beatrice Maingi. She is an experienced psychologist in private practice. She's passionate about psychological well-being and about restoration of human dignity, which may be stripped by disease. She has been involved in the implementation of workplace policies on psychosocial issues. A wave to the crowd, Madam Beatrice, thank you. We have then next Ms. Eva Mudhuri. Thank you, Eva. She has a deep and unique experience that will contribute to End Malaria Council's mission. Mrs. Mudhuri is already a member of the country's coordinating mechanism for the Global Fund for HIV, TB, and malaria, and this experience is valuable for understanding the challenges of health financing and strategies of the health sector. She is a business partner with E&K International Coffee, working in the agricultural sector, a trade expert, a woman, and a youth advocate. A wave to the crowd, Madam Mudhuri. Thank you. Then we have Mr. Isaac Maluki. He is the CEO of Shonza EPZ Limited and has previous experience in audit, financial management, and business strategy. His experience will prove invaluable as Kenya explores opportunities to promote local manufacturing of health commodities, such as insecticide-treated mosquito nets, and ensuring that the Council complies with the highest standards for financial management as it stewards the resources. Thank you. A wave to the crowd, Mr. Maluki. Then we have Prof. Matilu Mwao. He is a medical doctor and infectious disease specialist who does research at the Kenya Medical Research Institute. He's currently the deputy director of KEMRI and the director of the Center for Infectious and Parasitic Diseases Research at KEMRI. Prof. Mao will contribute a deep technical expertise and knowledge towards innovation and development of malaria control interventions. A wave to the crowd. Asante, Prof. Then we have Dr. Jacinta Wasike. Dr. Jacinta Wasike is a deputy chief pharmacist at the Pharmacy and Poisons Board. Jacinta has extensive experience with regulatory requirements for registration of pharmaceutical supplies in Kenya. She's an active advocate for the local manufacturing of pharmaceutical products in Kenya and works closely with the private sector. She will play a crucial role in helping our local manufacturing industry meet the required international standards of good manufacturing practices. Again, we salute her in absentia. Then we have Ms. Joyce Momanyi. Joyce Momanyi is here representing the Council of Governors, and she's the current head of the COVID-19 Secretariat. And as we continue to devolve in the health sector, particularly with county engagement, Mrs. Momanyi will be critical in ensuring that we have subnational and community leaders who assist us with issues of health and advocacy when it comes to fighting malaria. A wave for the crowd, Momanyi, thank you. And then we have Mr. Ronik Vora. The young gentleman there is a young graduate in business administration and works in sales and marketing and research development, director at Revital Healthcare EPZ Mombasa. He has been involved in the local manufacturing of PPEs, face masks, and rapid test kits, and he will also be the voice of the youth in the council. A wave to the crowd, thank you. And then last but not least, we have Dr. Willie Sakole, who we all know. He's the secretary. He's a medical doctor, a malaria specialist with extensive experience in public health management. Currently, Dr. Akwale is a senior advisor at the Africa Leaders Malaria Alliance, supporting His Excellency the President Uhuru Kenyatta's work as the chair of ALMA. Much of his career has been spent working on malaria prevention and control in Kenya and in the African continent. He has held several positions within the Kenyan Ministry of Health and in international organizations, and he brings to the Council experience working with global partners. He will serve as secretary and will oversee the day-to-day operations of the End Malaria Council Secretariat. Dr. Akwale, a wave to the crowd. Thank you. Thank you. And so that is our End Malaria Council. We thank you so much for accepting kuitikia huu mwito, and we welcome you to work with us. I think at this juncture, I'd like to then hand back over to you, Dr. Akwale.
Thank you very much, Madam Kass. Thank you for unveiling and really reading the bios. You can see the wide range of expertise. I can assure you this selection was not easy. I can assure you. Even as late as last evening, I got a lot of texts. Daktari, can you consider me for that council? And I can tell you for almost 2 months, the names kept changing until we got this mix. So it hasn't been easy. Now I'll ask the council members to pick a pledge form which is on your table. All the council members, there is a pledge form. We want to see you committing to ensure that we fight malaria. As you've been told, the president has already committed. And our cabinet secretary, let's give him back his pledge. He committed long time ago, yes. Yeah, just in case he had forgotten, I'm sure he hadn't forgotten. I want us to all sign. And once we've signed, I want us to, once you've signed, council members will come and stand first in front. You are going to hold your pledge here, just in front of the cabinet secretary, and then we will, the cabinet secretary will walk up on the dais, and we'll follow him, and we'll do the official unveiling. So council members, once you sign, just come and stand here in front. We do a bit of photo, holding it just below your chest. Yes, let's start with the chair. The chair is there, is already accepted the charge. Please come. Yes, Professor Ngau, please, just join. Eva? First, the first photo is just standing for the new members, those who are not signed. We have a photo of the cabinet secretary. He signed in Mombasa. It was a very hot afternoon, I remember. This way. Yeah. On this side. Let the right side be in front, eh? Yes, that way. Now, I will ask the cabinet secretary to come and we all sit, and then we are going to officially unveil. I'll also join the team. Yeah. another figure. Yes. Where is the chair? Chair, you need. Yes, will be here. Chair will be here. Is that? Yes, yes. I am here. So, we are going to ask the Cabinet Secretary to officially inaugurate this committee. And as that happens, after he says he's going to read his speech here, he will just say, welcome and officially inaugurate us. I think we'll all applaud for the same. So, are we ready? Ready? Okay. Well, I have been asked to say that I officially inaugurate this council and wish them all the very best. I know that it's going to be a bit challenging because I'm not making a speech, but I put it fast. Thank you. Thank you very much. Take your seats. Take your seats. Let me, at this juncture, now welcome the newly inaugurated chair of Kenya's End Malaria Council, so that you hear his voice and he can affirm to us his acceptance. Mr. Christopher Getonga, welcome. Let's clap for him. He's taking on a very big responsibility. Welcome.
Thank you, Dr. Akwale. Okay, Cabinet Secretary for Health, Senator Mutahi Kagwe, the Chief Administrative Secretary, Mercy Mwangangi, all protocols observed. To begin with, I'd like to thank His Excellency President Uhuru Kenyatta for his leadership in the fight against malaria as the chair of the African Leaders Malaria Alliance, and for his call to action for African countries to establish an End Malaria Council and funds. I would also like to thank the Honorable Minister of Health, Senator Mutahi Kagwe, and the entire Ministry of Health and its partners for prioritizing the formation of this council. On behalf of myself and the fellow members of the End Malaria Council, I declare that zero malaria starts with us. We are ready, willing, and able to meet the charge that we have been given. We dedicate ourselves as malaria champions and will work as partners to the National Malaria Program and the people of Kenya to end malaria. We begin our work as the End Malaria Council during an unprecedented and trying time. It is a time when all eyes are focused on health and health of the economy, and all are exhausted by the corona pandemic. We must, however, remain vigilant, especially given that malaria continues to afflict and kill many more people in this country, especially children and pregnant women. As the founding chairman of this council, I'm fully cognizant of the enormous responsibilities bestowed to me and my council. I understand that the mandate of ensuring that malaria remains high on the development agenda and to take action to ensure the implementation of Kenya's malaria strategy is not going to be easy. However, with innovation and collaboration for stakeholders, including the communities at risk, we shall prevail. So we call on all Kenyans to join us in our efforts as members of the End Malaria Council. We must do all our part. We must declare that zero malaria starts with me. One startling statistics, which I just read this morning, was that every 7 seconds, a new malaria case is reported in Kenya. I promise to do all within my power to raise resources to support malaria control efforts in Kenya from all sectors of the economy. I will also provide the necessary leadership towards ensuring the local manufacture of malaria control commodities like bed nets, medicines, to ensure we sustain our efforts and contribute to the economy. There are very many industries in Kenya that can actually produce all of these items that we need. And I think it's Buy Kenya, Build Kenya is one of the mottos of our president. In the coming weeks, we will be announcing a series of initiatives across all sectors to support the fight against malaria. If you'd like more information about the End Malaria Council and want to donate or get involved in the fight against malaria, please go to endmalaria.ke. I would also like to mention Dr. Willis Akwale, the Secretary to the Board, and just to say that we were just put together a couple of weeks ago, and he has been very, very instrumental in keeping us informed of what is coming and educating us on what we need to do. Thank you, Doc. I'd also like to thank Dr. Ganatra and Dr. Kithuku for the information that you gave us on the slides, very, very important information. Zero malaria starts with me, zero malaria starts with you, zero malaria starts with us. Thank you.
Yeah, ladies and gentlemen, you have a chairman now. You have a council and now you have a chairman. Every reason. He has already told you he's going to raise resources. For many years when I've been in the malaria world, people keep saying, we should diversify our resources. We should get local resources. Today is the day we begin that journey. And the chair has committed to that. Thank you very much, Mr. Chris Kitonga. So, ladies and gentlemen, I will now invite our Chief Administrative Secretary so that she can invite the Cabinet Secretary to give his speech for this day. Welcome, Madam.
Thank you. Thank you, Dr. Akwale. I'm just as excited as you are because really this is the beginning of a journey for us, particularly on local manufacturing. The potential is immense within the country. And so at this juncture, I'd like to invite the Cabinet Secretary, Senator Mutahi Kagwe, to come and give his keynote address today as we inaugurate members of the End Malaria Council. Karibu Waziri. I think they're cheering for you.
Thank you very much, Mercy. Distinguished ladies and gentlemen, and I can see a huge presence of my friends, members of the Fourth Estate. Good morning, and thank you for attending this important event to inaugurate Kenya's first ever End Malaria Council. Last year, upon taking over the chairmanship of the Africa Leaders Malaria Alliance, His Excellency President Uhuru Kenyatta called for the establishment of country-led malaria councils and funds as part of his legacy agenda towards the elimination of malaria on the African continent. Today, we fulfill His Excellency's call to action with the unveiling of Kenya's End Malaria Council. This council is the fifth to be launched in the African continent after Eswatini, Uganda, Zambia, and Mozambique. It will play a very critical role in mobilizing local resources to drive the agenda of malaria control and elimination in Kenya in a much more sustainable way. According to the World Health Organization's World Malaria Report 2020, and I recognize and appreciate the presence of the local representative, Rudy Eggers, there were 215 million malaria cases and 384,000 malaria deaths in Africa in 2019. It concerns us, therefore, that malaria incident rates in Africa has plateaued since 2015, when it was expected to be on a downward trend. Consequently, Africa is not on track to achieve its 2020 target of reducing malaria incidence and mortality by 40% and the goal of eliminating malaria by 2030. Whilst it's true, for the national average, the burden of malaria is not spread evenly across our great country. The greatest burden, as was ably demonstrated here in the presentation, is in Busia and Siaya, where incidence is more than 6 times higher than the national average. Many factors account for this, but perhaps none so much more than the presence of extensive number of breeding sites near homesteads. To mitigate against this, we plan to accelerate efforts that will include application of measures to spray and kill mosquito larvae at the source in these counties during the second quarter of this calendar year. And to ensure that those two and other counties also address other aspects aimed at fighting malaria, His Excellency the President recently launched the use of malaria scorecard, which will aid health workers and community members in identifying factors that could be responsible for increased numbers of cases. Once these are identified, it will be easy then to develop effective and targeted preventive measures. The year 2020, as everybody knows, was a terrible year we could wish to forget. The COVID-19 pandemic has changed our lives in an unprecedented manner. The pandemic provided another challenge in the noble fight against malaria. At the onset of the pandemic, the World Health Organization predicted a doubling of malaria deaths if severe disruptions to insecticide-treated net campaigns and access to anti-malaria medicines were experienced. Although Kenya continues to experience public health and socio-economic impact as a result of COVID-19 pandemic, I'm delighted to say that through commendable efforts by the government and its development partners, this predicted doubling in malaria deaths was averted. We ensured the continued distribution of insecticide-treated bed nets, the availability of medicines at our health facilities, and indoor residue spraying took place as planned, whilst COVID-19 protocols were being observed. As noble and esteemed leaders have remarked, the true measure, and I quote, the true measure of any society can be found in how it treats its most vulnerable members, end of quote. By ensuring that all Kenyans, and especially children and pregnant women, have access to life-saving medicines, insecticide-treated mosquito nets, and other commodities, we took and indeed continue to take steps forward. One of the key bottlenecks we have encountered during the COVID-19 pandemic has been the difficulty in securing essential health commodities, including malaria diagnostics, treatments, and vector control tools in a timely manner, especially when these have been manufactured outside our country. We must work together to ensure that those commodities are manufactured locally here in Kenya. By promoting local manufacturing, we shall reduce reliance on foreign manufactured malaria supplies and ensure economic development, as well as easy access and timely delivery of these essential commodities to the populations at risk of malaria. Let me make a special appeal here, particularly to our development partners and those who contribute with us. You saw the percentage of contribution that comes from our donor community. But I want to make a special appeal that they lay emphasis as well on local manufactured products and local manufactured pharmaceutical products. And I'll tell you why I'm making this special appeal. Is because on several occasions when we ask, why is it that we cannot buy locally manufactured materials, we know, for example, that there are organizations that have been exporting outside of Kenya to other countries, and yet we in Kenya are not buying from them, and these are Kenyan organizations. It just doesn't make sense. But we are told that some of these situations is because of the donor condition, the donor conditions, where you have got to go for a global tender, even when these things are being manufactured here in our country. And I want to make a special appeal to our funding partners that whenever we have got these products locally, please let us buy from our local manufacturers. And two things happen immediately. One of them is that we are able to move these commodities quickly. And secondly, we provide jobs. We give jobs to our people. Whenever you order 1 million, 2 million nets to be manufactured outside Kenya and brought into Kenya, you have just exported some 5,000 jobs. And if there's one thing I know we need in this country, it's jobs. The other thing we are told is that the process by which the World Health Organization, and I'm happy that Rudy, you're here, that the process by which the World Health Organization gives approvals, because the funding agencies tell us we can't buy because the World Health Organization has not recommended that product. And the process by which the World Health Organization takes in order for them to approve a commodity, apparently is so rigorous that some of our people are unable to meet those standards. And we don't want to compromise, of course. We don't want to compromise on the kind of quality of product that we have. But we have learned through the PPEs that we are making in our country today, we have learned that these things are possible. And therefore, I would like to request also the World Health Organization to look at the issue of fast-tracking, where local manufacturers can be assisted and where local manufacturers can be given priority. Because what we saw this year, and we have continued to see it, is that unless we are locally, unless we rely on ourselves locally, we will continue to be challenged. Take the current issue of vaccines. It is not that we don't have the money to buy vaccines, but the vaccines are still not available to us. Why? Because obviously the country is making those vaccines. We will give priority to those, they will give priority to national interests before they ever come to us. So it's absolutely critical. And I want to challenge the council, I want to challenge the donor community, I want to challenge the World Health Organization that we give priority for the local manufacturing aspect. And as a government and as a cabinet, we have pronounced ourselves on this matter, that at least the Kenya part of the funding will definitely go to local manufacturers. We also want to appeal to the local manufacturers to up their game in terms of quality, to ensure that the quality that we have of products in our nation are absolutely at best practice globally. So COVID-19 is also a stark reminder of the impact of disease on our socio-economic development. This is also true of malaria. Past studies have demonstrated that malaria reduces economic growth by up to 1.3% each year, and estimates suggest that workers miss nearly 12 million days of work each year in Kenya because of malaria. This is equivalent to removing the productivity of some 50,000 workers from our economy. Similarly, malaria reduces academic achievement and causes children to miss upwards of 3% of their schooling. A healthy economy requires healthy and educated workers, especially as we look forward to the recovery following the ongoing pandemic. To succeed in our mission to end malaria, we must address financial resource gaps that have been demonstrated here by the able presenters. And what Githuka said about the resource gap of 24 billion to fully implement our current malaria strategic plan, which covers between 2019 and 2023, is indeed a challenge. We must close this gap to ensure that we have the required malaria supplies to not only treat malaria, but effectively prevent it in the first place. And I want to emphasize that the issue of prevention. And it is not just malaria. As a ministry, the philosophy and policy that we have adopted is one of prevention, prevention, prevention. Primary health care, our public health effort is going to be intensified at the prevention level. Therefore, if you looked at the gap that was here, for example, the issue of intervention, spraying, and what have you, there was a huge gap of financing and funding. Yet, that is our top priority. We had rather prevent disease than cure disease. There's been too much emphasis on the curative aspects as opposed to the prevention aspects. And what we have seen is with hygiene measures, even during the COVID-19 period, it is possible to reduce the disease burden by working more at prevention than at curing. So we must expand our outreach in affected communities to ensure that everyone has the knowledge to protect themselves and their families against malaria. My hope is that this council will prioritize working and supporting community-led initiatives. This council, as you have seen for yourselves, is a public-private community partnership. Its members, as introduced, are senior leaders drawn from government, the private sector, civil society, and research institutions. Each and every one of you has unique experience and capabilities that will contribute significantly to the fight against malaria. This council is not a replacement of the National Malaria Program, which will remain primarily responsible for the technical implementation of the National Malaria Strategy. Instead, the council will advocate for malaria to remain high on the strategic agenda across all sectors of the government, the private sector, civil society, and sensitize all leaders to the importance of ending malaria. This council will drive action by the various sectors to support the implementation of Kenya's malaria strategy. This council will establish and manage a fund and can receive, manage, and disburse financial and in-kind donations from various sectors to close the budget gap under the Kenya Malaria Strategy. You'll also establish and implement transparent process to receive contributions, invest available resources, and receive funding requests from the counties and malaria programs. You prioritize actions towards promoting and strengthening the local manufacture of malaria control commodities and supplies, and identify priority activities for funding. This council will use their unique experience and capabilities to drive innovation and make malaria elimination more efficient, sustainable, and achievable. And finally, this council will promote mutual accountability between the sectors for the successful implementation of the National Malaria Strategic Plan and elimination of malaria by 2030. To support these efforts, my ministry, through the National Malaria Program, will provide quarterly updates to the council members on the status of malaria control and elimination and the gaps and bottlenecks that the country faces. We will also share the national and subnational malaria scorecards and work plans to ensure that the End Malaria Council work in a focused and evidence-based approach. Council members, it's so important that we eradicate malaria completely. And why so? Because by doing so, the many deaths occasioned by malaria will be avoided and more people will become more productive in the growth of our country's economy. Further, eradication of malaria will free the capacity of our health workers to address health conditions that cannot be avoided and also strengthen the resilience of our health system. It is therefore with great pleasure and privilege that I now inaugurate Kenya's End Malaria Council and charge its founding members to do the country proud by laying a strong foundation towards the elimination of malaria in Kenya. Zero malaria starts with me and with all of us. Asanteni sana na kazi kwenu. Thank you all very much.
Yeah, the Cabinet Secretary deserves another round of applause. Thank you for that. You realize he's really charged us and he's promised support. You will never ask for any more political support. That is no longer part of your vocabulary. It is there, it is given. Kazi kwenyu, that's what he said if you didn't hear. Kazi sasa ni kwetu. So as we come to end this program, let me really give some vote of thanks. And I really want to start with the Cabinet Secretary for the support he's given my office and my team and the entire Ministry of Health to ensure that today's function, despite a very short notice, has gone on well and has been successful. Let me also bring greetings and regards from the Executive Secretary of the African Leaders Malaria Alliance, Madam Joy Pumapi, all the way from Botswana. She passes her greetings and regards, Waziri, and she really wishes us luck, good progress with the Council. Let me thank the team of ALMA and MOH, who within almost 48 hours, we came up with a logo. You've seen the Council has a very interesting logo. If you look at that logo, it was developed within a day. The arms, which are the colors of our flag, is that we will defeat malaria. The mosquito will go down. The blood that it sucks from us, we are going to step on it until that blood comes out of that mosquito and it will never survive. That's what that logo means. So, and we put it down because it has to go down. We have to bury these mosquitoes. And we Kenyans will stand the victors. So when you see that logo, and I hope we are going to patent it, that is what it means. And also, if the website, within another 24 hours, we also managed to set up a website for the Council. Can it be screened, William? Can we see it live? If not? But we already have a website. You can visit. You will see everything. And actually, we've been streaming this event live on that website and through many other social platforms. Then let me also thank the media, the communication team for everything that they have done. And finally, let me thank those who created time to come and witness this event. Asanteni sana na Mungu awabariki. I will just request the guests and the Council. By the way, there is tea. For the Council members, we are going to have our first informal meeting around here in the hotel. And by the way, even lunch is served. So don't be in a hurry. So let's take our time. We may have a few photo sessions and then we'll start getting down to business. Asanteni, Mungu awabariki. Yeah. Oh yeah, and we need the pledge cards signed here. Okay. Yeah? Boundy. Who will pray?
We started with prayer. It's only fair we finish with prayer and recognize that it is God who has ennobled us. So shall we pray? Okay, we want to thank you, Heavenly Father, for this far you brought us. Thank you for taking care of us. Thank you even for allowing us to have an end malaria council for the country. We commit ourselves unto you that as we progress, Lord, you shall lead us and take care of us. Thank you for the good event that we've had and all that which is ahead of us. We pray that, dear Lord, you shall guide us and help us to accomplish. All this shall be for the glory and honor of your holy name. This is our prayer of faith in Jesus' name. Amen. Thank you.